Hi friends, I'm Dr. Rohit Udaya Prasad, lead consultant for ENT and Cochlear Implant Surgery at Vikram Aura Hospitals, Bangalore. I'm going to talk to you about cochlear implants and the cochlear implant surgery. Cochlear implants are the only bionic devices currently available which are used for medical purposes, where it helps to restore the hearing and provides the necessary auditory input to the person, enabling them to hear. This device has two components. One component which is surgically implanted onto the skull bone. The second device is a sound processor which connects to the surgically implanted device through the skin. They have a magnetic connection. The auditory processor sends the signals to the inner device, and the receiver stimulator, which is implanted onto the patient, converts these signals into electrical impulses and transfers these electrical impulses through the electrode which is implanted into the cochlea. The cochlea is the organ which houses the electrode, where these electrical signals are transferred to the nerve endings and they reach the brain. Eventually, the brain is the one which hears. If the ear is unable to do the job of converting the sound signals into electrical impulses, and the patient cannot hear anything at all or seems to be having a severe to profound hearing loss, these devices come into play and enable the patient to lead a normal life once implanted. They can be implanted in children who are born deaf, they can be implanted in adults who are hearing and lost the hearing, they can be implanted in elderly who progressively have lost the hearing and now are in some form of depression or some form of memory loss because of the hearing issue. All of them can be rehabilitated and brought back to mainstream to lead a normal life. Deafness is no more a disability when addressed at the right time. These implantable solutions are available for both ears. We do it at Vikram Aura Hospitals. We'll be glad to help.